Our session number 6 of the day. I'm very excited to introduce our panel. So as I mentioned, this is our 6th session of our Activity Strong 2022 Summit. This is our 3rd annual summit. My name is Charles Zevimran, and I am with this company called Linked Senior that leads this platform called Activity Strong, which is all about acknowledging, educating, and empowering activity and life enrichment professionals. And we do this in partnership and thanks to the amazing work of Activity Connection, NAP, and NCAP. And so I'm excited to introduce our panel in just a second after I go through a few quick housekeeping items, which is that we can earn up to 6 NAB, NCAP, NCTRC, and or NCCDPCU credits that are available today. To earn these credits, you just need to attend the full session, so as few as 1, as many as 6. Please fill out the CU survey no later than midnight on Friday, June 25th, so that we can process your certificate of attendance and issue up to 6 hours of these credits. Please note that due to the high number of attendees, we'll be sending these certificates via email throughout next week, which is the week of June 27th, and no later than Friday, July 1st, by the end of the day. If you have any questions, please send them our way by email to webinars with an S, webinars@linksenior.com. As a reminder, this session is being recorded. As I mentioned before, we are using Zoom, and I'm sure that all of us are very familiar with Zoom by now. But as just a quick note, we have different modes of communication. One is the chat, one is the Q&A feature. If you want your questions to be sent towards our panel, please send the Q&A feature. It's easier for us to manage that way. And if you want to share something with everyone, please select everyone instead of panelists and attendees. And then last but not least, for the ones that are playing our virtual bingo game today, the secret word, the code word, is the word right. All right, so talking about right, all right, let's go with our 5th session today. So I'm actually super excited to introduce this session. It's all about creating conscious awareness in the field of dementia care and why the arts matter. And so we have with us today, and I'll let each of you introduce yourself in more detail, but we have Dan Cohen, founder and CEO of Right to Music. We have Carolyn Edesis, Director of Senior Living Community Engagement with the Mather. Craig Price, Director of Community Education and Wellness for the Naples Player Theatre Company. And then obviously, last but not least, our moderator, Angela Duncan, who's the Executive Arts Director with Cognitive Dynamics Foundation. Before I give you the mic, Angela, I do want to thank you so much for taking the time to help us prepare. And I want all of you, well, the panelists, I'm sure you're aware of that, but the audience to know that Angela has been the quote-unquote driving force, and she has a very busy day today. So I just want to thank you, one, for helping us put this panel together, but also taking the time in enabling this panel, Angela. So what I'm going to do is just unshare my screen and video, but I'll stay tuned for your guidance, as I know that you all have different slides to share. So Angela, it's all yours.
Thank you so much. It is a pleasure to be here. And thank you to all of you who are hanging till the end of the day. I'm excited about this panel. I'd like to introduce my respected speakers and leaders in the field. We first have Dan Cohen. He is a master's level social worker and founder CEO of Right to Music, which advocates for integrating best practice music-based interventions into healthcare, especially long-term care for all persons with dementia. He founded Music and Memory, a nonprofit organization that promotes the use of personalized music to improve the lives of the elderly and infirm. The therapeutic outcomes of his work are portrayed in the Sundance award-winning documentary, Alive Inside. He has presented at numerous healthcare and dementia caregiver conferences in the US and abroad. Next, we have Caroline Edesis, and she is an art therapist and licensed clinical professional counselor with 20 years in the senior living industry. Her work has focused on centering creativity, engagement, and citizenship in program design for older adults, including development of open studios for older adult artists, arts engagement in diverse media, technology for creative connection, intergenerational creativity, inquiry-based mobile museums, creative strengths-based dementia care, and delivering a culture of creativity in care settings. In her current role, she oversees resident engagement across all Mather communities, and she applies research to support individual and community well-being. She is an artist and an art therapist with a Bachelor of Arts from Colorado State University and a Master's of Arts in Art Therapy from the School of Art Institute of Chicago. Caroline has a passion for infusing creativity into community life and employee training development. She has co-authored 5 papers. She presents regularly at national conferences, and recently her work has involved creating stronger collaborations between senior living, academia, and arts organizations, and positioning senior living settings as a creative aging incubators within the broader community. Next, we have Craig Price. He is trained and performed at the Second City Chicago and I.O. Theater Chicago in the 1980s and 90s. After leaving the Windy City, Craig then spent 5 years, 550 shows with Comedy Sports of Denver, then 5 years on the road as a stand-up comedian. When Craig landed in Naples, Florida, he found himself on the stages of the Naples Players as a volunteer actor and soon was hired as a teacher for the Kids Act program. He eventually became the education director, where he began teaching improv classes for kids with autism. Craig is proud to have created the wellness department at TMP and is currently serving as the director of community education and wellness, where he is running the wellness program, designing and teaching classes for kids and adults with developmental disabilities. Craig's classes focus on teaching communication techniques through improv games for all abilities and ages. Students young and old have found that fun and laughter in Craig's classes have helped them in many areas of their life, in home, work, and school. Classes include Laugh Online, Star Ability Improv, Thursdays Musical, Theater Mondays, Improv for Care Partners and their loved ones with memory loss, Tada Improv, and at the Arlington Retirement Community, Improv for ASD. Most recently, he does Improv for Communication Skills and Improv for Interview Skills for the Collier County Public Schools. And myself, I'm Angel Duncan, and I have an extensive background in counseling psychology, art therapy, and I'm involved in Alzheimer's disease clinical trials and biomarker neuroimaging research. My doctorate education is in gerontology, and I am the U.S. Director of Education for Medical Life Sciences at Life Molecular Imaging. I co-developed the Arts and Mind virtual young onset and early stage dementia program at the Yale University Art Gallery. I'm an adjunct professor at the University of Tampa, and I serve as the Executive Arts Director for the Cognitive Dynamics Foundation. I reside on the Medical Advisory Board for Lorenzo's House, a national organization for younger onset Alzheimer's support, and I chair and co-chair numerous neurosciences and creativity track symposiums throughout the country. I speak globally about dementia forms, research, the importance of diversity and inclusion in clinical trials, mental health, and the importance of creativity on the brain. I'm widely published, and I'm often in diverse media for my work in mental health and dementia. And I thank you all for being here, and I thank our speakers. And with that, I'd like to kick off with Dan Cohen.
Great. Well, thank you so much, Angel. Thank you for putting together this component of what's really been an inspirational and informative day. And I think visioning was mentioned earlier, and we need more visioning. And I think this today is really, with so many leaders who have great vision, have really helped us lay out a path for what's going to happen. So I'm really hopeful. I see movement. Many of us have been doing this a long time. It seems slow, but progress is slow. Okay, do care residents have a right to music? Is that in writing anywhere? Not that we know of, right? Are there guidelines on how much music someone should have access to? What kinds of music? What sort of music-based interventions that people deserve or should have? So that's sort of an opening question. So here I've listed just a number of ways that music can impact mood, behavior, other things. Now, would improvement in any of these areas merit such a right to music? Think of how we prescribe medication. We'll try any med we think might work, maybe for pain reduction or anxiety reduction. In the same way, wouldn't residents and families really appreciate music as a way to improve any of these issues? So does this sort of escalate our right to ask for more music if it's going to really work? Now, do residents have a right to the music they love? Now, this gets a little trickier. Once the day room is filled with residents, the music, for the most part, is chosen for them. Some might love it, others, not so much. Now, each of us only listens to the music we want. We start, we stop a number of times a day, wherever we are. We have total control over our selection and exposure and what types of music we listen to. And should the goal for our residents be any less? What percentage of residents have access to the music they love every day? So we don't have data on daily music access. We know the CDC has published that the average nursing home resident has 11 minutes of meaningful engagement a day and 20 minutes in assisted living. But how much of that meaningful engagement is composed of music or music that people really are enjoying? We need to find out. My guess is that less than 3% of the 2.5 million residents in long-term care have access to the music that they love every day, 3%. What number would you come to for your community? Perhaps think about what you might do to increase, the number, raise it from wherever it is. So not everybody gets access to music. So right now, people that run programs and provide different services in long-term care tell me that they get about a 30% attendance, or people that percentage of people are attending more regularly. So that's 2 out of 3 are not. And of course, that's due to many reasons. People aren't interested, they're unwilling, or perhaps they're just too sick, bedbound, they're on ventilators, they're in a vegetative state, and they have scheduling conflicts, dialysis 3 or 4 times a week. But what do we do for these folks? Is it just, they just can't make it? So, what do we do to accommodate them? And how do we increase that 30% number? And what's your number? We know we have to give people what they need to attend to their physical needs. We know we have to give them meals and meds. Meals they get 3 times a day, meds as often as needed. We know we want people to feel better. We want them to be more engaged. If music is food for the soul, and for many people, they'd say, yeah, music is really important for me. Let's make it as regular as meals and meds. Now, meals, we don't just give one meal and then just forget about it. No, meals give us energy for X number of hours. Meds, the dosage is for X number of hours or more. And music, because it has a residual effect when it's the right music at the right time, by the right person in the right way, has a residual effect as well. So if that's so, then why don't we aim for music 3 times a day, giving people music that will keep them lifted. So there are challenges. Today in other sessions, we talked about the challenges to increasing engagement, improving quality of life, lack of resources, lack of time, management support, lack thereof, involvement by other professionals, involvement by nursing. As was just mentioned, everybody should be involved. This is not just all on the shoulders of the activities and therapeutic recreation folks. It takes vision, determination. When I asked a therapeutic recreation team, when they had built out a very music-rich environment, when I started with them, they said, we don't have time. And so I said, well, what happened in the last few years? Now you have just an enormously fantastic, successful program. And it's what's changed? How did that happen? They said, well, it benefited the residents so much. It benefited us, sort of everybody. It just turned out to be what we do more. So tips, how do we address these obstacles, these challenges? In terms of lack of resources, communicating our needs internally and externally, lack of time. Note that more cooperative residents mean increased productivity. Things will just go smoothly when people are cooperative and less distressed. Lack of management support, focus on music's impact on key initiatives such as falls, antipsychotic meds reduction, which are major key initiatives for many folks. Music can play a pretty significant role there. Lack of involvement by nursing, highlight nurse productivity, the calmer work environment, improve morale, which tends to pervade an entire organization when there is, music everywhere. Mixing it up. So music is an accelerant to other forms of engagement. We can combine art and music, and Angel's going to talk about that in a few minutes. Combining music and exercise, we certainly get better results. Music and rehab, we will get better results when people are motivated to do those reps. Music and family visits help get things going when people visit someone who has advanced dementia. Let's light up the room. Residents, their families and staff, would love to be involved with this. They'd love to help. So in the last 10 or 15 years, a crop of national music programs has really matured. The top three here operate in large numbers of care communities. They're not all the same. Each one has a different emphasis and approach. And these differences and strengths can enhance outcomes. It's not an either or. Java group programs, music helps with peer support activity. Music in memory is rolling out personalized music to many people. SingFit, music to engage mind-body workouts. I've been speaking to the makers of different apps that are trying to build on what we can do with a regular streaming app, streaming service. And it's really interesting. They're really creative. They're smart and getting smarter, building in artificial intelligence, reading facial emotions, put memory tracks, for instance, which is made for CNAs. Whatever task is at hand, getting up, changing, bathing, there's, sort of the app is all developed per ADL and see what happens. And each one of them, again, is different in how they approach. And now we are all pretty much familiar with our smart speakers. Many of them have one or more than one at home. And many of you have one or, some or many in your communities. Smart speakers make music delivery even easier, enabling residents and staff to ask for the right music. So here's someone from housekeeping could go in and say, oh, play Mrs. Smith's, morning music. On it comes, and now we have something else to talk about. Mrs. Smith is more engaged. And it's not just good morning, how are you today? We really start getting into, oh, you love this artist, and what does it remind you of? Did you ever see him? Whatever. There should be one of these in every room. It's just that good. We don't give people, we said one meal or one med. So what are the best ways to provide the right music to each person? So we want to mix and match programs. So this is also about all the things that you're doing now. All right, you're singing, making music, live music, receptive listening by oneself or with others. Dance is just so powerful. And then mixing that with programs, apps, smart speakers. Sort of let's take that 30,000-foot view on the music that we have today and not looking at it just within activities in therapeutic recreation. Let's bring in other folks. Let's bring in leadership. Let's bring in nursing. Let's talk about music's impact that can help in so many ways. And what can we do to build this out? And let's up the impact by combining music with other leading national programs that are not necessarily music-based. But let's start thinking of how these things combine the way art and music combines. How do we mix and match for even better outcomes? This is our challenge. So sometimes we need to break through old thinking of music's potential. Use Alive Inside to break through any stigma of what's possible for persons with dementia. People are alive inside. That was why I wanted to make this movie, because I couldn't get through. People were not listening. How nice. Yes, we have music. Why bother? And the movie does a good job. It's used globally. Used. Thousands of people in long-term care have seen it already. It's a great way to break through with folks who don't get it. And then that can become sort of a icebreaker for conversation and moving forward. Use it as a tool to convey the efficacy, the power of music, and communicate your vision of what comes next. What music plan would be best for each resident? So now we're looking, let's put this together and let's build it into their care plan. That's the way we can assure some level of consistency and get others involved. The social prescription of music leads to better relationships, heightened well-being, and a better quality of life. Now that takes thought, planning, action, assessment, and follow-up. So have fun with it, and thank you so much.
Okay, I guess I'll pick up, I'll keep on going. Thank you so much, Dan. Let me get my screen shared. Hopefully we can do this smoothly. Let's get this, oh, too many things open on my, here we go. Okay, so I have to say thank you to everybody for, for doing this today and for, of course, inviting me to be a part of it. As Angel mentioned, my name is Caroline and I work for a company called Mather, which is a senior living organization based in Evanston, just north of Chicago, Illinois. We have senior living communities or life plan communities across the country. And we also have a research wing of our organization called the Mather Institute that focuses on, resilience, positive aging research, well-being for employees and residents. And our mission is really to change how people think about aging in this country. So I am an art therapist by training. So very quickly to define that word, I think more and more these days people know what art therapy is, but it is a field that combines more traditional verbal therapy with creative expression. And it's a master's level field. People that do art therapy work with a diversity of populations and practice in many different ways. If anybody from the last session is still on, from the Pioneer Network or Eat an Alternative or the Greenhouse Movement, I hope that you will take comfort knowing that when I set out to be an art therapist, 15 years ago, I was really driven not just by serving individual people and creating change for individuals, but I wanted to change how we do senior living, how our industry operates through creativity. So that's what I've been doing for the last 20 years. And I will say really quickly that at Mather, our art therapists offer the arts as a way for individuals to create and share meaning, and are really practicing in community, which is a very different sort of framework than just purely clinical behind a closed door sort of work. And we really train all of our team members, whether art therapists or engagement coordinators or program assistants, to have this actual social action community change mindset, which I'll get into in a moment. So I'm focusing my content today on what the team members in our memory support settings do, in our care venues do, while also acknowledging that we believe very strongly that creativity is important across all areas of senior living. But before I dive into some specific examples of that, I want to unpack some culturally loaded words. And these are parts of language that you might not expect to unpack today, because typically we're unpacking sort of person-centered, person-directed language. But I want us to think for a moment about these words that often get mixed up with each other. So first, the word art. So I want you to think, do you view art as something that is just created by the select few of society's geniuses that have somehow been touched by muses to be enjoyed with awe from a distance? Or do you think about creativity as something done by crafty people? So this is where people will often say, oh, you do arts and crafts classes. Or my sister is the crafty one. But I'd like us to think more today about this word creativity and agree on a definition of creativity, not as a gift from the muses granted to the select few, but something that we can all cultivate, a teachable practice and a way of connecting that is accessible to all of us and that should be woven into the fibers of our communities. And I love the definition by composer Stella Sung. She defines creativity as the expression of an individual's way of looking at the world and translating that viewpoint into something shared with the greater human community, which is so much similar to what we've been talking about today. And of course, I can't talk about this topic without mentioning Gene Cohen and his pivotal development of the theory of older adulthood as a creative age, which really flies in the face of this dominant idea that aging is just decline, right? So he positioned aging as a time of immense creativity, and that the aging brain is wired for innovation and reinvention and creative pursuits. And he actually did amazing research back around 2000 that older adults that engage with the arts use less medication, need to go to the doctor less, report higher mood, have less loneliness and depression, and of course are more socially engaged. And he did also talk specifically about dementia within that, but he's talking about aging, really globally. So perhaps the most important thing that I can use my 10 minutes for today is to say that we should not think of creativity as one activity box to check, one thing to prescribe. Say an art therapist leading a studio once a week, although I think it would be wonderful if all of the communities on this call had that, right? But I'd rather us talk about creativity as a fundamental reframing of how we think about dementia and ability and disability and how we provide care. So that's really what I'm going to focus on. And I want to do that by defining what Mather calls our culture of creativity. And this is really what we call our programs and engagement in our care venue settings. And this really relates to this topic of social prescribing, right? That the link between health and well-being and cultural participation is abundantly clear. And yet, as people have said, our care venues are often still so framed around the medical model that we have to really intentionally and actively drive in this direction. So we like to say that our residents are creators, not just consumers of culture. They are participants in the human experience, not just recipients of care. And specifically within that, our memory support settings are designed intentionally around a creative strengths-based model. So our residents work, or our art therapists and programs team members do work one-on-one with residents to address individual needs like isolation, anxiety, all of those things. But what I want to focus on is actually that we take a strengths-based approach, which means it's not all about using the arts to fix something that's broken, but rather using the arts to focus on what is working. And that means encouraging artist identity, capitalizing on existing creative strengths, and creating an environment rich with playfulness and connection and sensory joy. And so here's where I'm going to use my time to preach at you. We as a society emphasize a value system in which our worth is tied to independence, reason, control, all of those things based on past success. And within that value system, dementia represents, a real loss of identity, right? But people living with dementia have so many other strengths still present that are often completely overlooked. And so while we acknowledge that dementia is tragic and, really complicated and challenging to go through as an individual or a caregiver, we need to create environments and relationships that support creative and relational strengths rather than what is no longer working. And that is kind of the key of how I think about arts and creativity in our communities. So abilities related to creativity in the present moment, sensory enjoyment, emotional connection, all remain long into dementia progression. So even if people lose abilities like orientation, remembering names, sequencing tasks, every single individual has significant strengths that remain. And these strengths are most often tied to creative abilities. So expressing ourselves through song, moving to music, painting with vibrant colors. And I know so many of you on this call are right now thinking of stories of people in your lives that might not be able to verbalize a sentence, but can still sing songs at length, can still move to rhythm, can still love color and texture. And that's really about imagination, improvisation, and responding with authenticity. And these are strengths that we can cultivate in our residents and in ourselves every day. And people with dementia are often better than the rest of us at these things. So we need to get comfortable with their strengths rather than expecting them to conform to ours. And so that's why I advocate for emphasizing creative expression in memory support environments, not because all your residents have arts and crafts checked on their interview when they move in, right? But because creativity remains an open channel for connection and experiencing new mastery and learning. And because through this lens that I'm talking about, art is activism. Art in dementia care is not just therapeutic, it's activism. And we are training our team members to own that identity as a change agent. Because in our industry, in our current systems of care, unfortunately, demonstrating daily that people living with dementia are creative, connected, wise, capable is a rejection of dominant beliefs and value systems. So we have to hold on to that. I mean, I've been holding on to this sort of spirit for 20 years, and I'm not giving up anytime soon. So what does this mean in practical application? We mentioned creating one-on-one time with residents using creativity, not just verbal reminiscing, to connect with what matters. And that might even be, exploring these pivotal stories that people revisit daily. In this case, Don meeting his wife for the first time at the country club, wearing a yellow sport coat that she hated, but they had 50 years of marriage together. Inviting people to share who they are, but not necessarily within the confines of how we think about identity, or I am a nurse, I am married. We use I am poems a lot for that reason, reframing language in dementia as poetry, so freeing it from our expectations, entering the territory of creative expression, and getting to that concept of person-directed, allowing people to share who they are in that moment, not just always falling back on what we've been told is important about a person. So also using poetry to get at deeper shared experience, or storytelling can be used in this way too, writing about images. So in this case on my screen, I'm showing you a poem written by a group of ladies in a memory support setting about Faith Ringgold's story quilts. This is a good place to mention some other strategies for using creative practices across all programs that I know you'll hear from in a moment. Using improv or creative movement at the beginning of anything to increase connection between people, passing a movement around the group, mirroring each other, inviting reflections and responses together as expression of the group after walking in the garden, after anything, writing a big group poem about what's coming up for people. And these sorts of practices are a great way to consistently cue residents, staff, families that this is an inclusive, creative space where the rules are different and where we can let go of our fears of doing the wrong thing.
Active suspension.
Sorry, I'm not going to play it for you because I don't want to run out of time. So finally, I want to say using the arts to make stories visible, in this case, a comic book graphic novel project in a memory support environment. And then finally, where we are now coming out of the pandemic in whatever way that means, using creativity as part of employee self-care practices. And what we've been talking about a lot at Mather is post-traumatic growth. So this is a picture of a needlework sunrise created by one community's assistant director of nursing during the pandemic. They took pictures of the sunrises every morning as they came into work. And this kind of is a great way for me to wrap up this micro to macro, this idea that creativity can help fuel each of us individually, can help connect us each individually, but we can use that same energy to create community change, to create systemic change, and to even work across industries to create change. So my question for you before I pass the reins on is, what happens when we put creative connection at the core of a care plan, at the core of a community, at the core of a cross-industry call to action in the way we think about aging and ability and disability and care? So whirlwind sermon, I'll pass the baton.
Thank you, Caroline. Craig.
Wow, she was speaking my language there, Caroline, using words like improvisation, the mirror exercise. Oh my gosh. See, Angel, you did such a great job positioning Dan, and then Caroline, and then me at the end, because as the improv guy, I use music and movement and all of the things that these guys just talked about, and so many things that I've heard about all day long in our improv games that we play. I heard some great speakers today, and I really appreciate everybody for being here. I really want to thank Linked Senior, and I want to thank Angel for having me on this panel. Craig Price, the Naples Players Theater down here in Naples, Florida, and I'm the Director of Community Education and Wellness, as Angel mentioned earlier. And we're one of the few theaters in the country to have that, but definitely one of the only theaters in Southwest Florida to have a wellness department. And what we do is exactly what it sounds like. I go out into the community and I teach theater classes that promote wellness. And I'm not the only one in this department. I actually have another partner who she's a teaching artist, and she goes out in the community and she does more scripted material and uses things like we talked about earlier with the story spine, like Angela Burton talked about with Feet to the Fire earlier today. We do a lot of storytelling that way and creative playwriting, but all of my stuff is improvised, and because I can't use a script, I can't remember anything, and many of our loved ones cannot either. So one of the things that I do in my social prescription when I go out to these communities and I teach improv is exactly what Caroline was talking about. Is where we're actually using this slide that I have coming up, which shows the 5 core skills of improv and the yes and wheel. Charles, if you have that there, that would be great. If not, I can probably call it up and I can show you on a quick slide about what is improv and how is it used as the social prescription. All right.
And just give me 1 second, Craig. I have it right here.
No problem. So what this slide will show you is kind of the 5 core skills of improv and this yes and wheel that we use. And so this is the basic core of improv. This is what I was taught at Second City in Chicago. This is and I encourage everybody on this conference right now, if you haven't yet, go out and take an improv class somewhere. Doesn't have to be mine. It can be anybody's. We all teach these same 5 core skills of improv, and we all teach yes and. It's an amazing way to communicate in improv on stage, but also it's an incredible way to communicate with each other, especially when we talk about this social prescription and dealing with our care partners and also our loved ones with memory loss. So the way I got into this is I learned all of these techniques in improv and going out and performing them and everything. I never thought for a second that they would somehow come into play later in my life until my mom, my stepmother, was diagnosed with frontal temporal dementia. And, talking with Lorenzo's house, she was early onset. She was 65, and in 5 years, she's lost every ability to communicate except non-verbally. So these core skills of improv really helped my father deal with being the care partner. And watching him go through that care partner journey was, it was hard to watch because he's a lawyer and he wanted things just so, and everything had to be just like it's supposed to be. And the schedule had to stay the same. But that, as we all know, it does not work that way with someone who is living with memory loss. So I watched him go through that and I said, Dad, let's do some improv together. And I saw it work, where it prepared him to be a better listener. It prepared him to be a little bit more, little less rigid and a little bit more flexible in his care partner journey. My mom, also my stepfather, had dementia as well. And I watched my mom go through the same thing, being a teacher all my life. She had a difficult time being less rigid and being more flexible in her care partner journey. So this improv, 5 core skills of improv, and this improv yes and wheel, you'll see can be used not only on stage when we do improv, but also in life for care partners and also for our loved ones with memory loss. So I teach this to the care partners and professional care partners as well, not just folks that are taking care of somebody at home with memory loss. So listening. 5 core skills of improv. And those of you, I can't see your hands out there, but raise your hands if any of these 5 core skills of improv are something that you could use more of in your personal life and in your care partner journey. Listening. Could we all use more things? Oh, I see one hand go up. Excellent. There we go, Caroline. Thank you. So she used the virtual hand. Yes, indeed, we can all use more listening in our life, right? I know I can be a better listener, and I know that I love when I am listened to. Accepting, right? Accepting, for accepting of others' ideas, we're accepting of the situation, we're accepting of the changes that happen in our loved one and in our environment. That's always a good thing, right? We can use more of that. Look at the hands going up. I love it. Supporting. We got to support each other, right? On stage, I have to support my partner that comes out on stage, but in life, I got to support my partner. I got to support the people I'm taking care of. I got to support their ideas by being more accepting and listening. I can do that. And then taking risks. This is a weird one because a lot of people say, well, I don't want to take any risks. You know, we're not jumping off of any buildings here, but we're taking a risk simply by walking in the room and being prepared for anything that's going to happen with my stepmother. When I go to visit her at the memory care center now, I go in with these 5 core skills of improv in mind. And I know I'm going to come in, I'm going to try something, and I'm going to take a risk. It may not work. She may not understand what's going on, but if I let go of mistakes, the last one right there, how many people have a hard time letting go of mistakes, right? Oh my, I'm the king of beating myself up all day long if I make a mistake. It's like I had a friend that he tells me all the time, are you having a bad day or are you having a bad 5 minutes that you're gonna milk all day? And that's me, I'm the king of that. So I want to, yep, the queen of that. Excellent. Thank you, Cheryl. I want to encourage you to let go of mistakes. And in improv, one of the beautiful things is there are no mistakes, right? That's the wonderful thing that we love to say. Tina Fey says it so well in her book, Bossy Pants, that there are no mistakes. There's only happy little accidents that happen on stage, and we make those into every scene, like Bob Ross, right? We just take them and paint them into every scene, to use an art reference. I also want to tell you about some of the games that we play when we use these 5 core skills of improv, but I also want you to realize that those 5 core skills of improv we can all use in our daily lives. And it happens to be what goes on in this yes and wheel. This is how we communicate with the yes and wheel. And that is what everybody in any improv class will ever tell you is it's all about yes and. That's how we communicate on stage doing improv. And if we incorporate that more in our communication with our loved ones with memory loss, it is a much better way to survive. And I learned that the first day of improv class, and you will too, when you get out there and take an improv class. It's the same thing. So with my residents, when I go into like the Arlington or I teach classes there for the independent living and assisted living residents, and then also at the memory care or memory treatment centers of Bonita Springs, I go in there and take care of the care partners. We do classes while their loved ones are getting infusions. And then we spend time doing this yes and wheel. And this communication where we're actually communicating in the yes and wheel is a wonderful way to communicate, where we're saying yes to each other's ideas and we get to add something. As long as we're aware, we're accepting, and we're adding back, it's a continuous form of communication. And like we talked about earlier, one of the games that we do is we do the story spine, or we do one-word stories. We're in a circle, we're seated, and we're making up a story, and we're doing it one word at a time around the circle. Also, one of the games that I love to play, incorporating the music aspect that Dan was talking about earlier, is freeze dance. We do that game where we're just playing music and we're freezing. And out of those frozen positions, we do a game called Art Museum and the Statue Garden. And we're in the sculpture garden or the statue garden. People freeze as statues, and we walk around and describe what those statues could possibly be, what those positions are. We use objects that we find in your everyday life in the living communities, and we turn those into various inventions. And we do a game called Gibberish Shark Tank, where we do inventions with everyday objects, and we try to sell these inventions to each other only using gibberish. All these games create community, connection. They promote that understanding of each other, and they also really bring us all together. And like so many people have said today, that laughter is so interesting. In the next slide, you'll see what community activities director, just like yourselves, so many of you out there are wondering, what can this do? And a lot of these activities that you've heard talked about today, the music and the art and the writing workshops, improv is no different in that sense, that any of these activities, really not just improv, but they all have been absolutely life-changing for our participants. The fun and even vulnerable moments have created a bond like no other that has happened on our campus. Our residents and even employees who've joined in have had a little extra sparkle in their eyes when they see each other around. That sparkle is followed by some improv or an inside joke and erupts into laughter and smile-filled faces. How can you wish for anything more? That actually came from an activities director, just like many of you on this call, at one of the communities here in Naples. So that's it for my time. And I am going to turn it back over to Angel, and I'm really excited to hear what you have to say.
Thank you so much. Share mine. I'm going to switch gears a little bit, talking about the medical side, looking at social prescriptions from our medical side. And what does that mean? What exactly are we doing with our neurologists and psychiatrists and research centers? You know, I spend most of my time with pharma and medical communities. And I want to just talk a little bit about why we're here. Why are social prescriptions meaningful, and why do we need it? Is that a recent study in the Journal of Aging Studies was done looking at participants. They were 60 to 93. And they went around and asked them, I want you to identify some things in your life that are essential. What would be important? What are elements in your life that would be successful aging for you? And despite 60 to 93, there were 6 key elements that they came out. And that was having a sense of purpose. I want to wake up in the morning and know that I matter. Why am I here? I want to have positive interactions with others. I want to engage in personal growth. I want to have self-acceptance, and I want to be valued. I want to maintain some autonomy. I want to have some decisions. And I want good health, and that included mental, spiritual, and physical health. Would these priorities change when one has dementia? And I think we lose track of that, because absolutely not. Some quick stats I want to share with you, and this is why it's so important that we're looking at this, is because it's an estimated that 6.5 million Americans are living with Alzheimer's disease. We know that number is underreported. Why? Because Hispanic, Latino, Black African Americans, Indian, and Native Americans are estimated to be twice as likely to develop Alzheimer's disease. They're the most underserved population in research and have less access to treatment centers and awareness. So we know that's underreported. An estimated 1 in 8 over the age of 65 are living with Alzheimer's. About half, 50% over the age of 85 are living with it. And according to the Alzheimer's Association, every 64 seconds, someone in the country is developing Alzheimer's. Women, we are at a more disadvantage. We're more caregiving as caregivers, but our chance of developing breast cancer, we all know that pink ribbon and we take action. Her chance of developing breast cancer is 1 in 11. But her chance of developing Alzheimer's is 1 in 6. So how many are aware of the purple ribbon and getting your memory screens and having that? So that's important that we're looking at this. It cost our country $355 billion last year. And as you can see, it takes up the most out of Medicare, Medicaid than any other disease. And you can see it continues to escalate each year. This is where social prescriptions matter. And I'm going to get into why is it costing us so much to care in these types of diseases. We have breast cancer, prostate, heart disease, stroke, even HIV/AIDS. Who would have thought when we'd see the day we'd be managing treatments for that? Yet Alzheimer's continues to escalate. People keep saying, well, we're at the verge of a crisis. We are in a crisis, and we have been. This is where things are coming in on why do we need social prescriptions? Now, these are not disease modifying. These are symptomatic. They're supposed to help with the worsening of symptoms, but I think we all know most of these don't work. They have more side effects than they do good. And then Biogen just came out, and that was a very controversial drug. I was a part of that study. Happy to talk if anybody wants to talk about it offline later on, but this is what I want to focus on. Psychotropic drugs. These drugs have what's called a black box warning label. These are not designed to be given to people living with dementia on a chronic basis. And it's so easy to pop a pill and bill Medicare for it, or we're going to bill out of pocket for it. So let's look at how much this cost. $355 billion last year, and how many is going to medications? Quite a bit, because it's easier just to pop a pill, sedate the agitation. So what are we doing? We're doing a great job at sedating the behavior, but we are dramatically diminishing quality of life, and people that are living chronically on psychotropic drugs have higher fatality rates. We all should be nurturing, looking at alternative forms of treatment. We all have a story, and it's important that we're communicating that and we're living it. And most importantly, that we're teaching and advocating to our medical providers, our government, and our policy stakeholders. There's been a shift in neurology. We're still making that dent, but I think we're getting there. And I think you had the pleasure of hearing Dr. Daniel Potts earlier, and he is instrumental in helping in his practice and helping his peers see we need to do more. The first geriatric neurology textbook with a chapter dedicated to expressive arts therapy came out in 2014, not that long ago. But we can see all of these wonderful things that are starting to come out in our neurology books and neurology journals, movies, and film and radio and television. So we're starting to see the shift in the need for social prescribing. And Caroline, I'm not going to go deep into this, so thank you for saving me some time here, because Gene Cohen really did put the importance of creativity on the map. In his study, he looked at 65 years and older, both with and without dementia, seniors who were isolated, who engaged in the arts, and the same thing she mentioned earlier. All of these wonderful things happened. Activity, motivation, morale, and everything went down. That medication as needed, agitation, depression, all of that lowered. His theory was that creativity improves mental and physical health. Now, I want to focus a little bit on young onset. And if you were here earlier, you may have heard Diana from Lorenzo's house. That's where I was earlier facilitating her summit for her youth group. And we're looking at people with young onset, early stage, because this is one of the most vulnerable populations who do not have access to social prescription activities. And I see them in the research center, and it's important. It's 20 years in the field, and I'm constantly hearing people say, I'm too well to be in a senior center, or too young, and I'm not ready for placement. But yet I'm too embarrassed to be with my friends. I'm going to repeat myself, or I'm going to lose my friends, or I can't keep up with conversations. So the only outlet they have is a research center. So we're looking at, finding treatments and cures, but we need to be nurturing that health. Yeah, I want to find effective treatments, but I want to nurture your spirit. I want to embrace that life. So I started a program at the Yale University Art Gallery in 2019 for young onset, and I partnered with the Yale University Research Center. And then we went to the neurologist. And then we had all these groups from Connecticut coming in and sending their patients to us. And it was families getting to be families, couples getting to be couples. We had musicians that come in. The pandemic hit, ruined everything. So guess what? We went virtual like everybody else. So we did a virtual program, and now we're reaching people beyond Connecticut. We have people all over the country that tune in once a month for an hour, and we have pieces that we highlight from the Yale Gallery, and we talk about it. And what's pretty cool is that the Yale is they have one of the biggest private collections in the country. So we also have access to their art that's not on display and in the archive. So we get to see and talk about it. And then they create art and we share in the art. And we have couples that get to be couples. And I just got an email from the woman who was saying, this is the only program I feel like my husband and I get to be united together. This is it. And because, you know, we were going to just do this for the pandemic, but because it's been such a success, Yale has decided to keep this program on indefinitely. And if anybody's interested, I'm happy to have you. This is a free program. We do not charge for this program. Perfect example, Tom's thumb next to the green thumb. This was a gentleman who said, she's the gardener in the family. And without my wife, I'd be nothing. And I love her so much. And he kissed her hand and she started sobbing. And I asked if she was okay. And she said, he hasn't told me he loved me. I haven't had this connection with him in 3 years since his diagnosis. Art brings people together, it brings communities together. I had the pleasure of attending a research collaborative. These were researchers coming with people living with dementia, more early stage, and thought, what can we do? What do we need to do better? I want culture, I want change, I want creativity. I want impact of social activities. I want to feel like I am a part of this world. Here she is. We did a program at the Newark Art Museum, and she's like, this is my hand. This is me. I am a real person. You know, embracing that identity, embracing herself. And that's where that comes in, because people have a tendency to take on the identity of the disease. You are not the disease. That may be what you have, but that is not who you are. And we're re-engaging that. We did an article recently in the International Journal. It's now rotating in 15 countries, and it's the importance of social prescriptions between research centers and physicians and museums and art therapists and people coming together and serving one another for social prescription ways. Let's ease off the Aricept. Let's ease off the Seroquel. You got to meet Dr. Potts earlier, and hopefully Dr. Agarwal. I worked very closely with them. Dr. Potts and I started Bringing Art to Life in 2010. We sat down together and we created this program, because where does it start? It also starts with our physicians. We need to start training our physicians to be better physicians. And how do you do that? You get them while they're in school. So now we have medical residents in neurology and psychiatry. We have pre-med majors. We have nursing majors, social workers, expressive arts therapists, where we are teaching a semester-long educational elective about Alzheimer's disease and related dementias. They get to partner up with an art therapist in the community, and they get to spend 1 day a week with a resident. We partner them up and they make art together. And now we did it virtually, and we do it all over. And it's become an amazing outlet in really educating our future physicians. And we encourage physicians to come on when we're doing Art to Life, and they do. And we did an empathy study showing that residents who attended our program had a significant higher level of empathy towards their patients than those who did not have this. So in summary, as neurons in persons living with Alzheimer's disease diminish, does this rob their consciousness? You know, persons living with dementia are often branded as a complete loss of self. The need for social prescriptions is essential, and it strengthens community relationships. Advocacy starts with all of us. It is the cornerstone of the educational process in spreading awareness and demanding for better. And also, what's equally so important is that we're providing the opportunity. I keep hearing, well, yes, but, not yes and, yes, but. There's always a but, what we can't do. It's a budget, it's staff, it's the no's, it's the roadblock, it's the barriers. Let's cut through that. And how do we do that? And Caroline's doing amazing work right now in what she's doing on a national front and helping to break down these barriers. So it's important that we're including, and I thank you so much for your time, and I thank you so much for what you do. And I'd like to end it here and start with any questions. I'm going to look in the chat. Okay.
Thanks, everyone, Angel. Sorry. Go ahead, Angel.
Dan, I'd like to just start with you since you were speaking first. What advice would you give to direct care staff and long-term care that are trying to promote and engage music and arts interventions, but they keep saying, I'm having roadblocks? How do you work with that?
I guess two words I think of are confidence in the sort of the truth of the request, and persistence. Just because things are very much siloed in nursing homes, as in any organization, don't let that slow you down. There's no downside. It's all good. So keep pushing. You're in the right.
Thank you. Caroline, can I ask you exactly, you mentioned this earlier, what is wellness citizenship?
So I'll be really brief because I know we're going to run over time, but basically it's just a call to not think about wellness as something that an individual is pursuing alone, thinking about their own individual factors, whether it be, access, a disability or a diagnosis. We often think of wellness as a person running on a beach, right? Looking really young and able, and thinking instead of wellness within a system and looking at what are the community and societal factors that are helping somebody achieve well-being or harming that sense of well-being. And in the context of memory support, really acknowledging that we as a community are responsible for the well-being of individuals living with dementia that are really at the heart of our community. And we need to work together to break down those barriers rather than just saying, oh, too bad, you have this difficult diagnosis, good luck. So this idea that it takes the community to come together, and we all have to be dementia friendly, whether you work at the front desk or you work in housekeeping or you are an activities person or you're, it's all of our responsibility.
Absolutely. Thank you. I know we're short for, we're over 1 minute. I just want to, Charles, I want to give everybody a huge thank you. And
no, but just to be fair, maybe Craig, 2 words before we wrap up, because I just want to be fair to you.
Yes, thank you.
You're asking the improv guy to only use 2 words? I know that's difficult.
Yes, and.
Yes, and. There you go. Those would be my 2 words. But I just think I encourage everybody to go out and take an improv class, whether it be online or in person. It really will open up your mind to a whole new way of communicating that's going to be useful in everything you do.
Yes, and thank you so much for all of your time. Andrew, again, I know you've worked hard to navigate and have us all join today. Carolyn and Dan and Craig, loved your presentation. I like to think that often innovation starts with creativity, and you are creativity. So thank you so much for helping us innovate. I'll let you, please stay on. We have an amazing little kind of happy hour today.